Hi everyone, today I'm going to be explaining why neostigmine is preferred over physostigmine for the treatment of myasthenia gravis. Now before moving on to answer this question, I would like to discuss what myasthenia gravis actually is. So at the site of a normal neuromuscular junction in our bodies, when a nerve impulse is transmitted, at the nerve terminal, acetylcholine present in the vesicles is released into the synaptic space, from where the acetylcholine binds to the nicotinic acetylcholine receptors and brings about skeletal muscle contraction. And the remaining acetylcholine is further degraded by choline esterases so that overstimulation of these receptors does not take place. So this is what happens in a normal individual. But in someone who is suffering from an autoimmune disease like myasthenia gravis, autoantibodies are produced in the body against these receptors, which leads to a severe decrease in their number. So what can we do in such a situation? In such a patient, we administer anticholine esterases so that now more acetylcholine can be present in the synaptic space and it can bind to the lesser number of receptors and make up for the decrease in the receptors. So this is the rationale of using anticholinesterases in myasthenia gravis. Coming to the explain why question, why is neostigmine preferred over physostigmine? Let us look at the differences and find out for ourselves. Both of these are anticholinesterases. Physostigmine is a natural compound while neostigmine is a synthetic compound. Chemically, physostigmine is a tertiary amine while neostigmine is a quaternary ammonium compound, which is why it is lipid insoluble. On the other hand, physostigmine is soluble in lipids, which is why it can easily cross the blood-brain barrier, while neostigmine can't do so. The duration of action of physostigmine is 1 to 2 hours, while neostigmine can act for 2 to 4 hours. A very important point about neostigmine is that it has direct action on the neuromuscular receptors. This is because it has similar properties to acetylcholine. So, apart from also being an anticholinesterase, it has direct agonistic action on the neuromuscular receptors, which gives it an edge over physostigmine. Also, as we just saw that physostigmine can cross the blood-brain barrier, it gives us unwanted CNS side effects like confusion, convulsions, ataxia and tremors. These side effects do not take place in neostigmine because it cannot cross the blood-brain barrier. And since neostigmine doesn't cross the blood-brain barrier and reach the CNS, more of it is present to act on the peripheral system and on the site of choice, that is the skeletal muscle junction. So this was all for this video. Thank you for watching.